Hey everyone, welcome back to this week's research update. And the topic for this week is the vaginal microbiome and how it impacts reproductive outcomes. Um, a lot of the cases of preterm labor, we don't know what the actual cause of preterm labor is in a lot of patient cases, but we see that up to 40% of the time that a preterm labor occurs, there's some sort of an infection that's present in the endometrial environment. And so the vaginal microbiome, our understanding of it has shifted greatly over the last few years, particularly with new research being published this past month, 2020, looking at the complex role that a lot of the microorganisms have on reproductive function. So I think the most common microorganism that most people are familiar with is a lactobacillus species, and how they in general have a very protective role in the vaginal reproductive tract, in the uterine environment. Basically, the lactobacillus species help to reduce the pH in the vaginal epithelium and in the vaginal environment. So that reduction in pH prevents the growth of harmful species such as Candida and other gram-negative or gram-positive bacteria. So we see that this reduction in pH has that protective impact. And what happens in pregnancy is the vaginal microbiome shifts from a more diverse population to a more lactobacillus concentrated population. And the role of this shift from diverse to a more lactobacillus centric population is to help reduce inflammation. We see that it also may help to reduce the immune response to certain or the production of certain immune modulators such as prostaglandins, and we see that there's a reduction in the or an increase in the tolerance of certain endotoxins. But basically, the goal of this shift is to help support pregnancy and keep a healthy pregnancy. So, what can happen during pregnancy or even before pregnancy when you're trying to conceive is if there's a shift in the normal or healthy microbiome, we develop something called dysbiosis. And this dysbiosis can trigger an increase in the inflammation in the intrauterine environment, and also an increase in the production of certain prostaglandins. And bacteria largely occupy the vaginal canal, but we see that there's actually an increase in bacterial populations in the placenta and the fallopian tube near the ovary, and in the uterine environment as well. And this can happen asymptomatically, meaning it causes no complications, but in some cases it can. And it seems to be largely related to a impact of the level of inflammation and how damaging or harmful that impact is for the baby in the uterine environment. So we're looking at the role of different probiotics as an adjuvant therapy, meaning it's a therapy that's added on to typical antimicrobials. And probiotic therapy largely is preferred by some clinicians because it doesn't cause a shift or decrease in the microbiome in other parts of the body, such as the digestive tract. And B, it doesn't contribute to antibiotic resistance because we're not going to be using antibiotics in some of these cases. But the evidence around whether probiotics can actually reduce an infection is actually very controversial. Largely, the role we see so far for probiotics as an adjuvant therapy is it can reduce the recurrence of certain infections, such as yeast infections or certain bacterial infections, but only in the short term, so within a month of having the first infection, but no reduction in long-term harm or long-term risk of recurring infections there. But we see that the limited research does show that in general, it's very safe for the baby, safe for the mother, and it may reduce the risk of some of these infections from recurring. And it's very important that if you're trying to conceive, you have an evaluation to screen for symptoms that can point to a pre-existing infection that's already present. And in many cases, I think it's estimated up to 40% of cases, the infection may be asymptomatic, meaning there is harmful bacteria and you're not actually having any symptoms. So you may not even know that you have dysbiosis. But in the other majority of cases, we see that there's usually a change in some of the normal discharge. So it might be more, have a different distinct odor to it. There's a change in the color of the vaginal discharge. There might be pain during intercourse. There may be general discomfort or soreness, an increase in itchiness. So if any of these symptoms develop and you're thinking of trying to conceive, it's important to either have a swab done, a bacterial swab to detect what bacteria might may be present, or to have a broad spectrum antimicrobial to treat. And you can find a lot of treatments over the counter in pharmacies for different fungal infections such as fluconazole, which can be used topically, or it can be used orally. But it's always best to seek out healthcare from a licensed healthcare provider to see what's causing the symptom, what are the actual risks in your scenario, and what may be the best options to treat that infection, especially if you're having a recurring infection before trying to conceive or once you're pregnant. And the treatments that are used once pregnant are very different from once before trying to conceive, because a lot of the typical antifungals or antibiotics can be quite harmful for the baby and for the risk to basically increased risk to the baby. So if that's the case, it's always best to seek out an opinion with your general provider, a healthcare provider, or a licensed healthcare provider to see what might be the best therapy for you. But it's something important to consider, because it's not a typical conversation that's being had when you're trying to conceive, or if you've had a history of recurrent miscarriages, stillbirth, or implantation failure. The first thing a doctor or a healthcare provider thinks is usually not the microbiome or the bacteria that's present in the reproductive tract, but we're seeing with increased research what a pivotal and vital role it can have on the health of the pregnancy and the health of the baby. So it's an important new avenue to continue learning about as we have more information and more research that's going to come about in this topic, but also using the limited research that's available and see how it may benefit or support your treatment.